This
is Journal
club.
So Kevin, how's your gut? How's your poops?
My gut? It's kind of personal, don't you think?
I think you need to tell us. What if you're at risk for some disease?
I don't want to tell you, but if I did, then I would tell you that my poops recently have not been very good.
Well, that's not good. What if you get like heart disease or something?
Heart? What does my poop even have to do with heart disease?
More than you know.
Really?
It's funny you asked.
So Sienna, you want to tell us more about how Kevin's poop can be correlated to his heart disease?
Yeah, well, actually, recently they performed a study where they found a correlation between genera identified in people's stool that's correlated with heart disease.
Wow.
Specifically, atrial fibrillation.
That does not make sense to me at all. Can you expand more? Like, why are you looking at my poop, and then what does that have to do with my heart?
Well, they took a group of about 6,700 people,
That's
and
a
they
lot.
That is a lot.
Of poop.
6,700 poops? I could not even manage that.
Okay.
They collected information about the people's lifestyle from a self-reported questionnaire, which means it could be a little inaccurate, but the questionnaire detailed of comorbidities they may have, such as diabetes type 2, and habits that could influence the onset of cardiovascular disease, such as smoking and alcohol consumption. And yeah, they collected 6,700 things of poop.
Poops?
Stool samples.
And they sequenced it for genera, and they found correlations between 9 for prevalent atrial fibrillation and 8 for incident atrial fibrillation, with a few overlaps. So, for some background information, atrial fibrillation is, put simply, is like an irregular contraction of the heart. So it's inefficient, and it's correlated with having open heart surgery, or like being old, not having good physical health, and like just having a weak heart in general, and it can turn into more serious illnesses related to the heart.
So, I don't know, Kevin, this is a question for you, because you seem like a smart guy. So, like, I guess there's the link between the bacteria in your gut and your heart condition doesn't seem very obvious, but I guess the connecting factor could be the food you eat. So could you expand more on that?
So like in general, like the food.
Yeah.
So especially if you're eating foods that are like high in fats and oils and stuff like that. I've heard a lot about how like fatty foods can often cause like blockages in the heart, things like that. Cholesterol, exactly. And I don't know if you remember, like back in the day, there was a documentary about this guy who ate McDonald's for like a whole month.
Oh, really?
Yeah. So
Oh,
you
yeah, that's
totally
good.
supersized me.
Oh, and then he like...
Yeah, and then they like examined him before and after he had like a ton of health conditions and things like that.
Right, yeah.
So that's an example of like how food that you affect like can like just like the quality of your food, but also like how it can affect your gut microbiome, because it's really sensitive as well. And your gut microbiome helps with things like your skin or like your overall health more than you know. So that's why everyone's like, oh, watch what you eat, and that's why it's important.
Yeah, so I guess you have food like up here as the main causal factor, and then you have it affects your gut microbiome, and it affects
Yes,
your heart disease.
Heart disease, yeah.
So this is more of like knowing how the amounts of bacteria can correlate to atrial fibrillation. It's more of like a biomarker. Maybe could be predictive, but it's not like something you can treat that'll treat your heart
Yeah,
disease.
it's also a different approach than like, oh, like you're eating foods with a lot of cholesterol, so it's going to cause like artery blockages and things like that. It's more like affecting the bacteria in your gut and how that can lead to heart disease instead of like, other things that have been like previously well known.
They found a lot of correlations between what's in your gut, like the microbiome, and a lot of diseases.
Yeah, can we actually explore specifically like what bacteria they actually found that was like positively correlated, and then maybe the significance, like what foods may cause an increase in that number, or
and then also in the study they examined like prevalent atrial fibrillation versus
Incidence. So prevalent atrial fibrillation meant that the patient had it before the study began. So the cohort actually included people aged 25 to 74. So hopefully the people still in their youth don't have heart issues, but I would say a majority of them were above 50, and I mean, atrial fibrillation is also correlated with age because your heart is a muscle, and as you get older, if you don't work out your muscle by maybe sprinting or just keeping your body active, then it becomes weaker. And so that can lead to atrial fibrillation, or at least make it more likely. And so prevalent atrial fibrillation just meant that the people had it already, and incident means that they developed it during or after the study. And they did a follow-up of about 15 years after the study and took another stool sample and found another additional like 200 people that had atrial fibrillation. So they could use that because most doctors like to differentiate between the two.
Right. And I think you mentioned this, but like there are all these other factors that like already increase risk for atrial fibrillation, like age, smoking status,
Like diet.
Alcohol consumption.
Yeah, alcohol consumption.
Diabetes.
And in these large scale studies, they corrected for it using just some statistical techniques so that, well, there's still going to be some false findings, but you can be more confident that what's causing the discrepancy is actually bacteria.
Instead of like all these other lifestyle factors.
Right. Yeah.
Because, the big things that they noted that they corrected for was age, gender as well, because it's more prominent in men than women, hypertension, obesity, and diabetes mellitus. So it's interesting to note that 3 out of 5 of those, well, 2 of them being things that you can't control, are correlated with your diet, so or your lifestyle, I should say.
And then I remember you were talking about this one bacteria they found, lactobacilli, which you said was bacillus, which was found in
yogurt,
like probiotic yogurt, which is supposed to be good for you, but it also correlated with incident atrial fibrillation. So you want to talk about that?
Well, I don't know too much about why that would be. My thought is that a diet high in dairy is not good for you. It's very high in fat. And so if you eat a lot of dairy, it could be ice cream or it could be probiotic yogurt. But usually that's supposed to be helpful and it's supposed to be good for your gut. But maybe it just happens to be that those people had...
It's correlated with it, but not necessarily causal, right?
Yeah, no, not causal. I would say it's more, association's more like a coincidence, perhaps. But with the microbiome, it's very interesting because, you want a really diverse microbiome, which is why you need to eat a diverse amount of foods. So you shouldn't be cutting out things, you should be adding things, as they say, to get all your nutrients. And the genera reflect that. So because it needs to digest certain things. So if you have enough spinach, then you'll have the genera to digest spinach. But if you don't eat any of that, you won't have it. So that would be what's bad for you. And these things are usually associated with maybe foods that are high in trans fat, which is associated with cancer, and saturated fat, which is very bad for your heart. So,
I think linking these bacteria to maybe the foods that would cause higher amounts of them, maybe it can help us make more informed choices on our diet, food and our health.
Exactly, That definitely could be a follow-up study. It's also important to note they did this in Finland, and they recreated it in a smaller cohort, I think like less than 1,000 people in Germany. But because genetics plays a large role in the onset of cardiovascular disease, including atrial fibrillation, and also in your microbiome that could be correlated, or the diets of people in certain regions could be completely different. Like Asia versus Europe, I'm sure is completely different, and they could have different indicators there as well. So I think that it should be recreated in other populations as well.
So important to note, this study is only generalizable for now to white Europeans.
I wonder if they examine like a population in like China or like US or like India or whatever, right? Like it's like the genera that they found would be a lot different compared to like what they found in the study. Or would there be some overlap? I think that would be interesting to look at.
Like there are definitely different ethnicities have different prevalences of heart disease as well. So maybe it could be slightly linked to the cultural foods.
Exactly.
And maybe that could be linked to, we can look at what bacteria are more present in the gut microbiome, and we can link that back. It's just, there's a whole wealth of options.
Or there's even more like gut resilience in some populations, like they're more resilient to heart disease despite what they eat.
Yeah, maybe if they have a lot of spices or their culture eats a lot more vegetables, they'll probably be more resistant. As you say. But just kind of to sum it up, the significance is not that you should go poop in a cup and try and figure out if you're going to develop heart disease, but that this can be used to warn doctors so people can intervene in their lifestyle, not after they're diagnosed, but before they are. Because besides atrial fibrillation, I mean, these genera, especially the one, there's one that's called anorma, is highly correlated with other cardiovascular diseases like heart failure, which would probably kill you. So, so if incident atrial fibrillation tells us that it's not just something that you'll find once you have the condition, you can also find it before. So, yeah.
So just making more informed choices about our diet.
Yeah.
But also maybe biomarkers for treatment as well.
Yeah, and I think this can also be applied outside of the heart. As they continue to look to the stool samples, they can find correlations with a lot of things. So maybe when you go to your yearly checkup in 20 years, they'll take a stool sample and they'll tell you, hey, this is looking a little high. Watch out for the McDonald's. And it could be correlated with maybe, I mean, this is all hypothetical, the onset of Alzheimer's or something.
Yep.
And
I was wondering, like, because like now, especially in the U.S. here, like a lot of people's diet consists a lot of like fast foods and things like that, and a lot of unhealthy food. So like we know there's an effect on the heart, but it'd be interesting to see if there's an effect on maybe the brain or like other sorts of functions throughout the body, like over the span of like a long-term effects of these.
Yeah, they say the gut is the second brain. So
that is true.
Did they say that?
I've heard it.
Oh, do you know if there have been studies done in the past that link diets to gut microbiome, like what bacteria are present?
Yeah.
Then I'm sure we can.
Yeah, I think it could be.
Something
You mean like going in reverse?
Right,
yeah, for sure. I mean, I'm sure. I don't think food is the only influence on your gut. I mean, if you have like diarrhea or you vomit a lot, that's really hard on your digestive system, and you lose a lot of nutrients and bacteria. You just flood it out. But yeah, I mean, I'm sure maybe exercise habits could be correlated, but
or like
I'd say food's the number one.
I don't know if this is true, but like my parents always tell me, if you don't eat or whatever, like especially if you don't eat in the mornings or something, your like stomach acid will like start getting a lot of like acidity and things like that in your gut. So
I don't know about that.
Like especially like I don't know, my parents are always saying, if you drink coffee the first thing in the morning without eating anything, it's really really bad for your stomach. Like I don't know if something like that, like instead of like eating food, like the opposite of it.
It's kind of like when you drink a lot of alcohol at once, and they say like have bread and stuff.
Oh yeah.
It's because it kind of, I guess, slows the release rather than the alcohol or the coffee going straight to your bloodstream into your brain. The food can kind of absorb it.
Yeah, I should start doing that.
For alcohol?
Yeah.
But also the microbiome, I think it's more related to your small and large intestine, because that small intestine is where like your nutrients is absorbed, and large intestines where you absorb the water and turn like liquid stool into hopefully solid stool. But yes, stomach, I don't know if it's really as correlated because acid kind of kills everything. But
also, like, let's say you're eating like a bunch of like junk food, like if you like eat like like they do all those like probiotic supplements, right? Like, they eat, and like that's supposed to have like good bacteria within it.
Yeah.
Do you think that would offset some of the effects of?
Yeah, I would.
Yeah,
I'd say
sure.
so.
Like that's the whole point, I guess. Yeah, I mean, like there's so many ways we can talk for minutes
Forever.
about this. But like I hope we've given y'all at least a good idea of how the gut can actually be linked to your heart, because I definitely didn't know that 15 minutes ago.
Me neither. That's crazy. So maybe Kevin, you should start like taking care of your gut first, watching what you eat.
I mean, I really like
this is the
McDonald's,
sign.
but like
every time I see you, you're always eating like junk food, and like you're eating these
it's kind of
spicy
embarrassing.
like foods, and like
Yeah.
I'm really concerned for you. 'Cause I would
like
hate
it
to lose
though.
you.
I like it.
I would hate to see you in the hospital with atrial fibrillation.
Okay, I don't know.
Stay alive for us, buddy.
So
Okay.
we'll leave it at that, I guess.
Thank you for watching. Take care of your gut. Very important.
What's the order?
Kevin Chen signing off.